There are many diseases out there, but the one that doesn't get talked about the most would be gestational diabetes. And all mothers, all expectant mothers especially, should be aware of the dangers of gestational diabetes, how to get treated, tested, and manage their everyday lives. Gestational diabetes occurs usually around the 24th week of pregnancy. What happens is your body stops being able to absorb enough insulin to break down the glucose for both you and your baby. It is important for you, as a mother, to know the signs and symptoms of gestational diabetes and to always discuss any family history of diabetes with your doctor. What is gestational diabetes? Women who have never had gestational diabetes develop insulin resistance during pregnancy and are said to have a condition known as gestational diabetes. Gestational diabetes occurs because the hormones during pregnancy block the action of insulin, causing a buildup of glucose in the mother's blood. The glucose then gets into the baby, causing it to make the baby extra large. And the extra glucose in the baby can cause a condition called as macrosomia, which, if you're having a vaginal birth, can cause severe problems like shoulder dystocia and other such symptoms. It can also cause your baby to have low blood sugar when it's born. Even though a woman has never had gestational diabetes, she can still develop gestational diabetes in her pregnancy. 18% of pregnancies present with gestational diabetes. That makes approximately 1 in 50 to 1 in 20 developing gestational diabetes. And even though it's common mostly among minority groups, no one is immune to gestational diabetes. What are the risks for gestational diabetes? Even though there's no known actual cause for gestational diabetes, there are some risk factors that both you and your doctor need to take into consideration. Having a family history of diabetes, being overweight or obese, not eating healthy, not exercising properly, and having had gestational diabetes in a previous pregnancy or given birth to an extra large baby previously. Along with the risk factors, you need to know the symptoms of gestational diabetes. If you ever have any of these symptoms, it's most important to talk to your doctor right away. Blurred vision, excessive thirst, frequent urination, headaches, and feeling tired or weak for no apparent reason at certain periods of time. And with it being so difficult to tell the difference between regular pregnancy symptoms and those of gestational diabetes, all women get tested around their 24th week of gestation. The first test is a 1-hour glucose test. If you fail that 1-hour glucose test, you then go in for a 3-hour glucose test. This is a fasting test, and they make you drink a nasty syrup. First they draw your blood when you get in, they make you drink a nasty syrup, and then they draw your blood an hour later. If you pass that first glucose, they send you back in for a 3-hour where you get tested 2 more times on top of the first 2. And they see how that goes. If you fail that one, then you will be diagnosed with gestational diabetes. Once it has been established that you do have gestational diabetes, there are steps that need to be taken. 1. Talk to your doctor. 2. Always do your research. 2. Talk to a nutritionist about starting a diabetic-friendly diet. Talk to a diabetic specialist who will help you learn how and when to test your blood sugar. Create and use daily exercise routine that best fits your schedule. And always take your medication as it's prescribed. There are many factors involved when it comes to the diagnosis and treatment of diabetes, so it is important to talk to your doctor and make the necessary changes as soon as possible. Although gestational diabetes cannot be avoided, it can be treated and managed, and is not by any means the worst thing that can happen during a pregnancy. Having gestational diabetes does put you at risk to develop type 2 diabetes later in life, but it is important to stick to a healthy diet and exercise plan even after your pregnancy. By losing 5 to 7% of your total body weight after pregnancy, you can lower your chances of developing type 2 diabetes later. And breastfeeding also helps It helps you to lose the weight, and it helps prevent your infant from getting diabetes and yourself. A healthy baby makes a happy baby. And parents, be forewarned and take care of yourself, because there's a whole nother life you are responsible for now.